What's your observation? How did the whole healthcare system or the government failed to really help the people who needed the help?
Well, there is no public health system in the United States today. I mean, that doesn't exist. There is no coordination. That's a problem. So, even in the vaccine rollout between cities and states and counties and how it was being distributed and where you could go for a vaccine, complete uncoordination. And this was true in the early measures of every state had its own rule, and then every city had its own rule, and different counties had rules on whether to wear masks or not. What were the mandates? Completely changing and chaotic. So the lack of any measure of coordination, and at the same time, an insistence that the solutions be in the hands of private corporations in areas where they could make a profit. So even the tests, China immediately developed a test, told the whole world how to make it. Countries started making it. The United States did not use those tests until another test rolled out, which turned out to be a disaster, and then still another one that one corporations could sell at a profit to the government to be distributed. So from the beginning, the rollout of testing was completely chaotic and profit driven. All different corporations and the testing done through all different private corporate labs. And then the same thing happening with the vaccines. The hospitals operate in the same way. Every service is contracted out to different competing, not even using the same software. I mean, it is difficult to even describe at what level, when there is not coordination, or even now the antigen tests, testing for variants, is hardly done in the United States compared to other countries. So when countries announce a new variant, it's as if it came from there. And so when South Africa announced the Omicron variant, the response was similar to what it had been to China. It was a racist response, and it was to block all flights coming from South Africa, even though the next day Europe announced that the Omicron was everywhere, but they didn't block flights from Europe. So it became known as a South African variant. With a really racist tinge to the whole reporting and description. It was because South Africa was testing for variants. The United States was hardly doing that. And between sending the tests and it being measured was a 10-day wait. That's very slow when you're talking about viruses. I don't want to get too technical here, but these are the real problems when you have no coordination, not enough testing, and it's all being done by just a hodgepodge of different companies, each operating on a for-profit basis. And I just want to say my own experience in even trying to get tested for COVID. There were just hundreds of COVID testing sites because any lab could set up a card table and do tests. You get paid for every one of them. But as soon as there was an outbreak, they couldn't keep any of those situations staffed. So we stood in line for hours in the freezing cold. And then there was only one person operating this clinic that should have had many, many people. Everybody else had called in sick. We went to another place and stood in line that stretched out to the highway, and then turned out that it wasn't open. They hadn't notified anyone. There wasn't even a sign on the door. Went to a third place. I'm just describing my own experience in trying to get a test. So, and I'm not the only one. I mean, I see how long the lines are and how difficult the testing is. When they say 1 million people tested positive in a day, you think of all the people who just couldn't stand in line because they're seniors, because they're in nursing homes, because they're disabled, because they have kids at home. You know, so. And by the way, this million testing positive does not count the rapid tests, the at-home tests that they give out. That doesn't get rolled into the CDC count. Only the lab tests do. So I can take a rapid test at home. I test positive. Who do I report it to? And I first did take a rapid test at home, tested positive, knew I was sick, and yet, okay, I know, family knows, but there's no government collection of that data, no way of having any local agency or state or national that's gathering that. So that's another complete disconnect.
So that means even the 1 million global record of reported cases in a day is still under reporting.
Big under reporting.